I hope you're all having a great day. I want to cover some hot topics today. A lot of this is going to be misconceptions about body contouring surgery, so let's get right to it, okay? Probably the number one misconception I see is that a patient believes that they can have liposuction and don't need any skin removal. And I think that a lot of plastic surgeons are guilty of showing results right after surgery with patients laying on the table where the skin is swollen and has not had a chance to get the swelling out and then wrinkle up, because that's one of the most common revisions I see. So if you're over 30, you've had kids, your BMI is over 30, most likely you will need skin removal. Otherwise, you'll be returning to have skin removal surgery within the next year when the swelling goes down. Okay. The second misconception is that everybody can have a drainless tummy tuck. So what is a drainless tummy tuck? It basically means we don't use any drains and the tummy tuck's performed, and the idea is that you use quilting sutures to close off the space. Well, I will say that the quilting sutures are a part of every tummy tuck. The difference is that when patients are getting aggressive liposuction, most of them are going to need drains. And the reason for that is that the blood has a way of collecting in the area where surgery was done. And blood is a physical barrier to healing. In other words, your skin has to adhere to your abdominal wall. So if blood is present, then the tissue adherence cannot occur, and then later you'll get a fluid collection. That fluid collection may go away eventually, but you'll have an abnormal cavity on the inside that could potentially cause issues or repetitive fluid collections or infection down the road. The next one I want to cover is skin tightening. So along the lines of liposuction, we're talking about most patients really need skin removal with liposuction when it's done aggressively and done correctly. All of these devices are sort of gimmicks that you see for skin tightening. I'm not going to name names, but we know what they all are. This idea that there's a substitute for skin removal by using heat or lasers is really absurd. If we think about laser lipo, has been around for a long time and it's basically been abandoned. Some of these are just offered as gimmicks because there are some patients out there who just feel like they have to have the latest technology even if it's not of benefit, and they're willing to pay to do so. The next one I want to talk about that I believe is a gimmick is that these concepts of auto augmentation. So what does that mean? The idea that I can use part of your breast from a breast lift or reduction that I would normally remove and now use it to augment your breast to increase the size is ludicrous. We know that these are not correct. I still see these put out there by plastic surgeons. Again, the results are shown immediately after surgery. The problem is that, for example, the bottom of the breast is something that needs to be removed on breast lift or breast reductions. So if now we're trying to relocate that tissue from the bottom of the breast to the top, but we're still leaving it attached to the bottom, the problem is that tissue is going to bottom out and you're going to have the same problem in a matter of time. So don't be fooled by that misconception. Also along the lines, this idea that for patients who are undergoing lower body lift, that we can use their lower back to augment their buttocks is ludicrous. It does not work. Again, we're leaving the tissue attached to the back and trying to relocate it to the buttocks. So it's extending from the lower back to the buttocks, which results in a high sitting tissue, which is more around your waistline than actually in your buttock, and is a joke. So please don't do that. And the better option is really fat transfer. The next thing I want to talk about is this idea that we can use larger implants to lift the breast and avoid a breast lift is ludicrous. If you need a breast lift, you need a breast lift. And I'll tell you, even if you have a little bit of droopiness, you need a breast lift if you are having implants. And the reason for that is that the implant will now fall to the bottom of the breast. So instead of putting the implant where it belongs and lifting the breast, we are now lowering the implant abnormally low to match the low breast, resulting in a complete loss of the upper half of the breast fullness and a tendency for patients to be reoperated on within a short period of time. Again, additional costs and stuff. So the last one I'll mention, last two actually, are permanent stitches for muscle repair. Not needed. Scar holds you together. Permanent sutures do not hold you together. All they are is a potential for infection for a permanent foreign body, and I've had to operate on other doctors' patients and remove them when they've become infected. So don't believe that misconception. The last one is for my weight loss patients. If you've had massive weight loss patients, you don't necessarily need a fleur-de-lis or vertical incision. Some doctors routinely do it even when it's not needed. If you're doing a lower body lift, or if you're adding an upper body lift, it can be avoided in most patients unless there's some degree of severity. So hopefully that's helpful for you guys. Let me know if you have any questions. Thank you.